I'm Katie Tahamtan. I am a certified orthopedic specialist and the lead pelvic floor PT at Riverside. I work at the medical office branch in Williamsburg. I chose to go into pelvic floor physical therapy because at the time I was in an orthopedic residency and I really liked all the skills that I was learning. But my favorite thing about physical therapy was the relationship with patients. And usually I'd get to this point where we had really good rapport and they might ask me a question about something a little bit more sensitive. And I really didn't like that I had to send them to someone else. So I thought, okay, if they're comfortable enough to ask, I feel like it's my job and my responsibility to learn how to treat these things. So I took the first class and from there I was just completely sold. As a pelvic floor physical therapist, the services I offer are very similar to traditional orthopedic physical therapy, but I've had the training to be able to extend that to diagnoses of the pelvic floor. So as far as the type of patients that I see, it's men, women, all ages, all kinds of issues. It can be pain, it can be incontinence, which is leaking stool, urine, or gas. It could be pressure, or it can be people that just haven't responded to treatment with traditional orthopedic physical therapy for back pain, hip pain, knee pain, all sorts of things. What that typically ends up being, people are familiar with how this can be beneficial after pregnancy, surgeries related to bowel, bladder, anything reproductive. But can also be athletes or just people that are interested in getting a little bit more of a full chain kind of approach to things. I think the most rewarding part of my job is when someone comes in and they're a little bit skeptical about what we can do. And it's not because I'm here to show off my skill set or anything like that, which I take pride in what I do. But my favorite thing is just seeing that hope come back for people, especially with sensitive things, because nobody wants to be vulnerable and put themselves out there like that. So when I get to witness that, that's a huge privilege. As a physical therapist, I worked in private settings before coming into Riverside, and I think especially as a specialist, sometimes you are looking at things that you wouldn't necessarily traditionally have to look at, you're really going into depth with looking at operative notes, really in depth with medication history, looking at things from multiple specialists, the whole chart. Having full access to that and also working with doctors that are very open to collaborating is a huge benefit. There's not that adversarial kind of hierarchy approach, you're really all there to support each other. And I think as a therapist, that really helps you to shine when your knowledge is respected and you know that you have good mentors that you can turn to and get a bigger, more holistic point of view when you're treating somebody. Since coming to Riverside, I have had a lot of opportunities thrown my direction, and I've seen that basically management is really open to a lot of what I'm bringing up, which is huge for anybody that's ambitious but has ever worked in a system where it doesn't feel like your input's always heard or respected. And I think that as far as opportunities go, with pelvic floor specifically, we're working on a bunch of different initiatives right now. We have existing collaborative classes where we go into prenatal sessions. Unlike the traditional prenatal visits where you go in and it's one-on-one every couple of weeks, at Riverside we also have the option of going to group classes where they host different topics every couple of weeks and you come in with people at a similar stage of pregnancy and kind of learn together.